So for our webinar today, we're going to be talking about an introduction to global aging data, which is a resource that we've developed here at USC at the program on global aging, health, and policy. And it's kind of a central repository for researchers who are interested in studying health and retirement, with a particular set of health and retirement studies which are asked around the world. So let's talk about what those studies are, where data is available, and we'll talk about how to get access to that data later on. So starting in 1992, the Health and Retirement Study here in the U.S. began, and it's a nationally representative panel survey of Americans over the age of 50. All of these surveys are longitudinal surveys, so in general, they are conducted every 2 years. There's a couple differences with that, and they're almost all nationally representative. So in 92, the Health and Retirement Study started. That's done at the University of Michigan, and that's a longitudinal survey which has been going since 1992, which means for certain cohorts who are part of that study, we have more than 20 years of data on them because, of course, they, if you started at 50, then you would come back at 52, 54, 56, and you would do this all the way up until the present survey. Then starting in 2001, the Mexican Health and Aging Study began in Mexico. This is called the MHAS. The MHAS had a survey in Wave 1. Their Wave 1 was done in 2001. They had a follow-up survey in 2003, and they then took a 10-year gap, and they came back into the field in 2013, and they have another follow-up in 2013. And actually, when they came back into the field in 2013, they interviewed all those original people also. So you get to see where people are 10 years later, which is gives you a nice bit of a chunk of a lifespan of someone using MHAS. The English Longitudinal Study of Aging was the next survey to come online. That study is referred to as ELSA. We then get a multi-country survey, which is called a Survey of Health, Aging, and Retirement in Europe, SHARE. And over its lifetime, SHARE includes 19 European countries plus Israel are included as part of SHARE data. We then get the first study, which is kind of outside of North America and Europe in 2006, and that is called CLOSA, or the Korean Longitudinal Study of Aging. The Indonesian Family Life Survey is actually an older survey. It was started in 1993. But as they saw all these different studies coming online, they decided to make their survey more comparable to these other surveys. And we'll talk about what it means that these surveys are comparable to each other. So starting in 2007, the IFLS, or the Indonesian Family Life Survey, became comparable to these other surveys. The Japanese Study of Aging and Retirement was then added in 2007. The Japanese survey, I will say it's referred to as JSTAR, and it is the one survey which is not nationally representative, but they would argue that their sampling framework kind of provides them a general sense of the Japanese population. There's one more multi-country study which is included as part of this network of studies, and that's the study on global aging and adult health. It's called SAGE. It's conducted by the World Health Organization. It includes China, Ghana, India, Mexico, Russia, and South Africa. They had their first wave, which was conducted between 2007 and 2010, so kind of a long span to cover all of those different countries. And they also have Wave 2 data coming shortly. We then have a survey called CHARLES, which is the China Health and Retirement Study. It's a really exciting study that a lot of people are interested in using, as there's not a lot of nationally representative information currently available on the Chinese population. And the last study that come online is the Longitudinal Aging Study in India, which is referred to as LASSI. And the center here that I'm part of, we are one of the organizing partners for LASSI. We had a pilot survey in 2010, and we will hopefully be going into the field for a baseline later this year. LASSI is particularly exciting because it's nationally representative of all of India, but it's also representative of every state inside of India. So these are kind of the network of surveys that are together. And what it means that they're a network of surveys is that they ask survey questions, they're designed to ask survey questions in similar ways, even given the differences in things like language or culture or setting or government or institutions. So they cover some core content areas. These include health, cognition, diseases, emotion, injury, physical functioning, which are things like, if you're familiar, ADLs or IADLs, which are counts of how many things people might encounter on a daily basis that they have difficulty with. Health behaviors, those are things like drinking and smoking. They also include questions usually about healthcare utilization, some things like health insurance, healthcare expenditure, out-of-pocket spending. We know as a lot of people move to end of life, your health units where you spend the majority of your healthcare money throughout your lifetime. So questions like these are asked. They also track labor force, employment status, earnings, disability, retirement. So when someone started to consider themselves retired, what are do they enjoy their retirement? How is their retirement compared to their life before when they were working? What were the characteristics of their work when they did work, or if they are working currently? What is that work like? Is it manual labor? Is it an easier job? And then questions also about pensions. What is their pension scheme that's available to them or that they're currently living off of? All of these studies have been designed with a lot of input from economists. So they include a whole host of economic variables, which include income, wealth, consumption, which is often used in developing countries as a better way to judge household means, perhaps better than income, earnings, government transfers, housing, and then financial and non-financial assets. And there's also a set of questions which relate more to social aspects of a person's life, and these include family structure, social network, family demographics, family exchange. So if, for instance, you're supporting your children or your children are supporting you, and whether that be through help with day-to-day activities of living or through finances. Questions about marriage, and then social participation, so questions about how often do you attend the religious service, how often are you involved in your community, do you volunteer, these sort of questions. So one of the power of these surveys is that, as you can see, it's not just a health survey, it's not just an economic survey, it's not just a labor survey, but these are long surveys, but they're designed to be able to give a researcher a fuller grasp of what someone's life looked like, because of course our lives are so interconnected. Your health is of course very related to your employment, which is also very related to your family network and your finances. So using these surveys, you're able to kind of grasp at some of the connections between these different areas. I'll mention briefly a couple of key innovations that were used in these surveys, starting with the HRS here in the U.S. So one is they wanted to enhance the quality of economic data. So you often have this issue in survey data particularly, is that there's a non-response bias, so that on certain questions that you might ask someone, you might get higher levels of people not responding to that question. And you particularly see this with economic data. So for instance, if you ask me a question like, I'm an American, so I have an investment retirement account, an IRA. So you might ask in the survey, Dristan, do you have an investment retirement account? So it's quite easy for me to say, yes, I do. But then if you ask me how much is in this account, I would really have to say I don't know. It's something that I check maybe once or twice a year. I make sure that's still there. And I kind of go on with my life assuming that this is accumulating for my retirement. The problem is as a researcher, if you wanted to include me in your data and I didn't have a response to that, it's very hard to do that. You would usually end up dropping me. The problem is that there's a bias here in these non-responses. So for instance, people, for this example, people who have more money in an IRA are less likely to report this, or people who have multiple IRAs from multiple levels, multiple different jobs that they might have, are less likely to report this. And of course, it's very easy to say, I don't have that account, so we know that value is 0. But there's a bias of these people who are not reporting. So starting with the HRS, a set of unfolding bracket questions were introduced. So if we get to the point in the survey where I say, I don't know how much I have in that account, the interviewer then says to me, well, is it more or less than some amount of dollars? So we could say, is it more or less than $50,000? I can say, okay, so it's more than $50,000. I know that, you know. And then the interviewer says, okay, so is it more, less, or about $100,000? And I could say, well, it's less than $100,000. I know that. So what I've given you would be, as the researcher here, is I've given you a range in which the true value lies. And that's particularly helpful for imputations. So with imputations are when a data is assigned to a missing value in a way that we hope doesn't bias the analysis, but allows you to keep that respondent inside of your data. So this is kind of one advancement, especially relating to economic data that you see in these surveys and this data. And the second that I'll mention is integrating biomarkers into social surveys. So as you saw, we have all these different kind of what we call kind of social survey aspects of someone's life. But we also have biomarkers in that a lot of physical measures are collected. So physical measures are things like blood, height, waist circumference, and then also some kind of checks. Vision tests are often conducted. A test called timed up and go. So how long does it take someone to stand up from a chair and walk kind of like across the room a couple of yards? They also have timed walks or a balance test. So you have this kind of real hard data. It's not self-reported that you can also use in this. Blood measures are collected by a few of the studies, and this is helpful for looking at things like cholesterol. And again, it's not self-report, right? You can actually see what's going on in someone's body. And then kind of the newest, most exciting biomarker to become available is genetic data. So for the HRS in the US and for ELSA in England, they currently have a full GWAS available for researchers. All of these studies also are freely available for anyone doing research, so there's no fee to use any of these, and they're available to anyone doing research anywhere in the world. And that's true for these biomarker measures also. So as you can see, there's a lot of different surveys. They cover a lot of different areas, but they also offer a lot of power to study things between different countries and different settings and different cultures, right? Which is quite exciting to be able to exploit some of the differences that we see in different cultures and think about how those are playing into the retirement, the bettering or the worsening of someone's life over time, and particularly longevity. So we developed the Gateway to Global Aging as a central resource for researchers who are looking to use these studies in collaboration with each other. And here are kind of the features that we built into the Gateway to Global Aging data. So that includes a digital library of survey content or survey metadata, and I'll talk about what that means. We built illustrative flowcharts showing skip pattern. We built a survey concordance for kind of easy kind of searching, more like Google style searching through these surveys. Interactive graphs and charts. We provide a lot of documentation on cross-study comparability. We've developed harmonized data files for cross-country analysis. This is probably the thing that researchers use the most, are these harmonized data files, which are kind of subsets of the original survey data, but they're subsets of the data which are most frequently used and most easy to be compared across different studies. And then kind of the last feature we've developed is a searchable library of publications based on health and retirement surveys, so you can find other research that's done, particularly using data from that study. So quickly I'm going to switch over to our website. So our website, the Gateway to Global Aging Data, is available at g2aging.org. Like all of these studies that we've talked about so far, this website is also publicly funded by the National Institutes of Health here in the US. So it's freely available for anyone doing research. If we click here on the home button, you can see that across the top we kind of have the different functions of the website, and we'll be going through these as we get to know kind of more about these surveys and more about kind of the tools that are available for you to use these surveys. So first let's talk about, I said that it includes an index of survey content or survey metadata. So I think the first thing to know about the Gateway to Global Aging data is that in general we don't actually provide survey data in the sense of a data set that you would download that includes the respondents' answers to the questions. So almost always this data is distributed by the original study. There's a few exceptions to this, including Lassie. So if you're interested in using the India data, you can download that from a website. What we do catalog for all of these studies is survey metadata or survey content. So survey metadata provide detailed information about all parts of the survey without providing the actual survey microdata. And when I say microdata, I mean that data set that you would download that has that SAS or SPSS or data set, which has the answers that people gave to the questions. Survey metadata is kind of the survey questions. What is included in the survey? How is it asked? Where is it asked in the survey? Are there any interviewer prompts, answer types and choices? How the question was asked and to whom. So not all questions are asked to every respondent. Some are asked just to one respondent in a couple or one respondent in a household. We do include links to microdata variables and how those values are formatted. So for instance, if there's a survey question, we will say, if you have the data set, here's the variable name in which that data is stored for this question. We've assigned research topics, keywords, and domains for a little better searching, and we suggest similar survey items. So let's look at an example of survey metadata. If you click here at Surveys at a Glance at the top, you can see all the surveys, again, which are cataloged on our website. I find this screen especially helpful because you can see when different studies came online. So for instance, if you're interested in comparing something globally that happened in 2010, you would be using wave 10 of the HRS data for the US, wave 5 of the ELSA data for England, and for instance, if you're interested in Korea, you would use wave 3 of the CLOSA data. You notice we refer to these in waves. Usually the baseline survey or that first survey is called wave 1, and then every follow-up survey has its number. But these wave numbers, of course, don't relate to the year they were done, so this chart can be especially helpful. Often, I'll briefly mention also, we have this study overview tab just to the left of the core interview tab. And this is helpful, especially if you're interested in some of the sampling eligibility, which is different between different surveys. So for instance, this first line here, we have the age eligibility. So you'll notice that CLOSA for Korea, Charles for China, and Lassie for India, they start people in their survey at 45. So they followed people 45 to end of life, whereas a lot of the other surveys start at 50 or 51 and follow to end of life. So that's an important difference that you want to keep in keep in mind if you're comparing those data. Another one is whether one person in the household is eligible, or all people are eligible as long as they're age eligible. And this differs by different surveys. Another thing to keep in mind is whether the spouse is included. And for instance, is the spouse included if the spouse is under the age which is targeted by the survey? So a lot of these things are important to keep in mind. We've kind of provided the study overview tab just to give you some really basic information about differences in the sampling framework. So we have that core interview tab we looked at, and that's kind of the main interview with all these parts of it. There's a couple of different types of interviews which I'll mention. So one is a self-completion interview. This is an interview which is usually left after the survey. It's sometimes called a drop-off questionnaire after the interviewer leaves the household, and someone fills this out on their own. So we've cataloged all of these surveys. A few of the surveys include a life history survey, which is a little bit separate. And this goes through all of someone's life, usually from childhood into the current, and say, give me information about all of the relationships you've been in throughout your life. When did the first one begin? When did it end? When was the next relationship? They do the same thing for jobs, disability, and other aspects of your life in this format. As I mentioned, there's biomarker information, and these are included in the health assessment. So for instance, you can see here in 2006, grip strength was conducted for SHARE, for Europe, for CLOSA, for Korea, and for JSTAR in Japan. And you could look at how those questions are asked. Exit interviews, which are also called next of kin or end of life interviews. And this is when an interviewer comes back to someone's house and they say, you know, I'd like to speak to John again this year, and they say, oh, like John passed away last year, and then and the interviewer says, okay, well, would it be all right if we interview the next of kin to John? And they ask questions to that person about what the last, about, you know, what were the conditions of John at his end of life. And then there's a community survey for just a few of the studies. But let's go back to the core interview, because most of what we're interested in is probably in the core interview, at least initially. So for instance, if we were interested in using, let's say we want to look at Europe, so we'd use the SHARE data. We could look at SHARE Wave 2, which was conducted in 2006. You can see here that inside of these surveys, usually are divided into survey modules, which are questions of kind of a similar topic, which are grouped together. So for instance, we could jump into mental health here for SHARE 2006 and look at these questions. You can see we have questions here about sad or depressed last month, hopes for the future. You'll also notice there's a couple of other items which are the top here, and these are identifiers. And then you can see it changes here with this icon to just questions. So we're looking at questions. So let's jump into this first question, MH002. So you can see we have a short description, which is sad or depressed last month. This is a question. The question text is, in the last month, have you been sad or depressed? And there is some interviewer instruction here. So to the interviewer, there is this text which says, if participant asks for clarification, say by sad or depressed, we mean miserable, in low spirits, or blue. So that's helpful to know. The answered choices are yes or a no. You can see here that a yes is categorized, is coded as a 1 in the data, and a 5 is a no. We have this associated variable, MH002 underscore. So if you have the shared data, that is the variable in which this is stored. And in this case, this makes sense, right? Your question name is MH002. The variable in which the data is stored is MH002 underscore. It is not always quite so simple for other studies. SHARE is quite nice in this way. You can see that we've assigned a topic of depression. We also have concurrent items, and this is that same item asked at different waves. So for instance, if you're interested in looking, maybe if this question changed at different waves, you could look at this kind of, these concurrent items, so the same question asked in 2012, 2010, 2004. And then we also say researchers were also interested in. So someone else has been using the website who was looking at this question, and looks like they were interested in the number of children, current job satisfaction, and satisfied with job. So they were kind of comparing those. So sometimes we think this might be helpful if you can look at what other people are interested in also. It might be what you're interested in. So that's kind of the base metadata we have for each survey question. So one way to go through, it's like we just currently did. If you know which survey you're interested in and you know the survey modules, you can kind of click through. It's not the only way. You know, usually on the internet we just search for things. We see a blank search bar and we search for things. So we developed a survey concordance or a search page. So you can find you can identify comparable survey measures between all health and retirement surveys, and you can do that using keyword search. Top-level research domains, so kind of broad research domains like health or cognition, and then finer research topics for harmonized studies. And again, these harmonized studies, these are data sets that we produce here at the Gateway to Global Aging Data, which are just subsets of the original data, but there's these subsets which are made to be kind of as comparable as possible to each other. So a lot of the legwork is cut out for you, and I'll talk quite a bit more about that. So if we jump back to the website, let's look at our concordance. So for instance, just a quite easy example is we could just say, for instance, we're interested in height, and maybe we're interested in height in China, how in the Charles survey it was asked. You can see as soon as we click this that our years here are grayed out for the years that Charles was not conducted in. So we can click here 2010, and we can just click search. And what we'll get are all the questions which somehow relate to height. So it looks like there's a couple different, quite a few different questions about height here as part of Charles, and that includes, here we've got knee height, this QH006. For any one of these, you can go into these and get more information. So this is record the chair height from the floor to the seat in the space provided, right? So this is chair height, which is probably for a timed up and go question. And you can look through these. So that's kind of just a really easy example. I'll show you one more example using harmonized data. So for instance, let's say you were interested in looking both at the English data and the rest of the European data. So we would use the harmonized ELSA, harmonized share, and then we could click a real fine topic like number of children. So we can click that and click search. And what you'll see here is that we get all the questions from all the waves here, which are related to number of children for both share and ELSA. So you can see some of the advantages of using harmonized data here is that these are really similarly named. So in harmonized share, a variable called H1 child is the number of living children of the respondent and the spouse. And then H1 child in the harmonized ELSA is also the number of living children for the respondent or spouse, but for wave 1 of ELSA. You can also see we have a flag variable here for share, and that's because share included imputed values, that I mentioned before. So they assigned a value to people who said they weren't sure how many children they had. So they assigned this value to them. So we include that value, of course, but we also include a flag saying this value was assigned to them for your analysis and not reported. Let's look at one more example through the concordance. So we could also search for something like health in general. There's kind of like general questions people ask about self-reported health. Let's go back to our European data so we can look for share. And we'll look at share 2004, so that first wave of share. What we get here in our search results here is, it looks like you can see that there's kind of appears to be 4 different health in general questions. So version 1, version 2, and then again, version 2 and version 1, and they all come from the same module. So maybe it makes more sense here if we're trying to figure out kind of what's going on here is to click on the module, so physical health. So you can see this kind of item list that we saw earlier. We have a couple other ways for you to view a survey module, and one is a codebook view. And the codebook view is more of a traditional way to look through a survey. So for instance, you can see our first question is, how would you say your health is? And you get a scale here. It looks like there's some kind of skip pattern going on. So else, if you weren't asked this, then you get asked this question, how would you say your health is? So you can see there's some kind of survey skip pattern that's going on. And the survey skip pattern is really important to understand. It's kind of one of the kind of first hardships that you will learn about survey data is that not every question is asked to every person. And of course, surveys do this because it doesn't make sense to ask someone a certain question, for instance, a question about each child, if we know that they have no children. But if you're just, what it means is that if you want to use a variable of how involved they are with each child, you also have to account for those questions asked about the number of children. And this is that kind of survey skip pattern. So we've also introduced flowcharts. So for most of the surveys, we have a flowchart module also. So for instance here, at the beginning of this physical health module of share in their wave 1, the respondent gets a random number that's generated. And this number is a 1 or a 2. Half the sample gets a 1, half the sample gets a 2. For the first sample, they get asked this question, how would you say your health is? Very good, good, fair, bad, very bad. If you didn't get a 1 and you got a 2, you get asked this question, which is how would you say your health is? So it's the same question, but in this case your scale is different, your reporting scale. So they ask excellent, very good, good, fair, or poor. So you notice in the difference of the scales that this second scale, this is actually the US scale for self-reported health. And you'll notice it's weighted a little more towards feeling good. So there's 3 levels of feeling good in this survey, 1 of feeling fair and 1 of bad. And in this first version here, this is a European version, and it's very symmetric. So there's 2 levels of feeling good, 1 level of feeling neutral, and 2 levels of feeling bad. So one of the things that SHARE is doing is they want to maintain compatibility to different surveys. And so certain surveys use this US version, and certain surveys use this European version. So they include both questions, and they ask this to different people. So if you're just using one of these, you might wonder why half of the people have a missing value, for instance, if you're using the variable for this first one. So you can use this flowchart to understand the survey skip pattern, which only asked this question to half the survey. Of course, then you can look through all the other parts of this survey and see the survey skip pattern. You'll also notice here at the very end we get asked these questions again, because you remember there was 4 versions of this question. So it looks like if you had a 2 there at the beginning instead of a 1, then you get asked the US version of the question, and if you had a 1, then you get asked the European version, which is to say that everyone is asked both questions, but at different times in the survey. And timing in survey is also an important reason to use flowcharts and to understand where questions are in a survey, especially with a question like self-report of health. If you ask me just in a general day, how is your self-report of health, I would probably say good. But then if you sit me down for a 20-minute interview where you ask me about all the falls that I've had in the last 2 years, all the times I've had to go to the doctor, the medications I'm using, and then you ask me how would you say my self-report of health is, you generally find that people report a little bit lower. So it's really important to think about where a question is asked in the survey, and especially when you're comparing between different surveys, this is quite important because the self-report of health question might not be asked at the same place in the survey. So you want to be able to have a good grasp of how things are asked in a survey for your research. I'll show you one more really simple example of a flowchart, which we'll come back to a little later. So this is a skip pattern for a question about smoking and drinking, in particular smoking. So the first question is, have you ever smoked daily? If the person says yes, then they're asked, do you smoke at the present time? So you can see here why you wouldn't ask everyone, do you smoke at the present time? Because you're wanting to save time, time of the interviewer and the respondent, of course. So you only ask those people, do you smoke at the present time, who have ever smoked in their life. What that means, if you want to make a variable about smoking now, you're going to have to account for both of these variables and not just one. We've also built interactive graphs and charts. And the idea of this is to kind of give you a way to play with the data a little bit before actually downloading data and generating statistics yourself. So if we go back to the website, we can click on graphs and tables. You can see here the first thing that will happen is we'll get this graph which is generated comparing currently working for pay in China and the US, and this is age 55 to 64. You can see here are different options for all the countries which are covered by these studies and the years, and then we have a select group of around 30 different options that you can graph for. Of course, this is not extensive to all the questions which are asked at all. We are hoping to expand this list in the future, but currently this is just kind of give you an idea to play around with the data. One of the nice things about the graphs and tables is that we're not just generating estimates for the sample. These are actually population estimates, so they are weighted, and in particular we've also accounted for kind of the complex sampling design of part of these, which can sometimes produce odd standard errors. So these are all taken care of in the background for you. You can see there's a graph. There's also tables for each of these. These tables are nice because they include missing reports also as part of them, and you can also see standard errors here and how many people were included in this sample that we're generating these stats from. For all of the graphs in the tables, you can download them. For instance, for the graphs, you can download in 4 different formats, and for the tables, you can download in CSV or PDF format. And again, if you do include them in your research, we'd ask you to cite them. So let's generate a graph here. So let's say we're interested in comparing the US, England, Japan, and Italy. We'll keep our year as 2010, and let's say we want to look at smoking rates. So ever smokes, and we won't filter that by anything. We can generate this graph, and what we see is that it looks like England and the US are quite high. So we can see in England 63% for the target population of ELSA, which is of course 50 and over. We would estimate, would say that they've ever smoked. For the US, that's also 56. And for Japan and Italy, it looks a little bit lower. So in Italy, it's 45, and Japan, it's 42. This is interesting to me, of course, because it seems like if I visit Italy or Japan, that I see a lot of people smoking, and I don't see a lot of people smoking currently in the U.S. in particular. So one of the things you might think is that, of course, this is an ever question. This is not who's smoking now, but maybe, you know, of course, we've had some changes in our culture. So we could generate a graph for smokes now. When we generate this graph, we see something really different, right? So we see in the U.S., for our target population of the HRS of 51 and over, we would estimate that 15% of of that target population would say that they smoke now. As England, it's 14%. Japan is 15%, so very close to England and the US today. In Italy, it's actually much higher, which is 18.8%. If you were interested in comparing just one country, so for instance, if you were looking at just Italy, you can also compare across subpopulations. So we could compare across different ages, genders, income, or wealth. So let's just look across different genders and see if this is gendered. And yeah, so actually it looks like smoking now. Inside of Italy, it looks like so 24% of males of the shared target population, we estimate, would report having smoked, whereas it's only 14% of males. So you can see there's something gendered going on. So with these graphs and tables, we just want to give you an idea of kind of some of the power of using these data, particularly together, to compare different things between different countries. So I'll show you a couple more examples. So here's a graph that we generated for total family income for England. This is in 2004. And it's over 3 age groups. So instead of the subpopulation of gender, here we've done age. So we have an age band of 55 to 64, 65 to 74, and 75 to 84. And what you can see is that the distribution is really changing for these 3 age groups. And that makes sense as people are moving for a more earnings-based income to probably a more pension or savings-based income. Here's a larger graph comparing more countries. So this is comparing China, Japan, Slovenia, Sweden, England, and the US. This is a graph of whether currently working for pay. We've filtered this graph to only look at people who are 55 to 64. And you can see kind of an immense variation here, particularly between Slovenia and Sweden, right? So in Slovenia, less than 25% of the people who are 55 to 64, we would estimate would report currently working for pay. But in Sweden, you know, it's more than 75. It looks like 80% of the people. So you get this kind of extreme variation. And of course, you know, this is really going to affect what retirement looks like for people in both these countries. And these are both European countries. So there's a lot of differences here you can play with. You know, you can compare when people seem to be really underemployed in Slovenia, what does it look like for them to move into retirement versus in Sweden? And what can other countries learn from these two different kind of models of moving into retirement? Here's one more graph, and this is looking over different years, so you can also select multiple years. In this case, this is the net value of primary residence in the U.S., and you can see we go from 2000 to 2012. Of course, we've got a lot of years of data from the HRS for the U.S. You can see both in the median and the weighted mean that housing prices are generally rising in 2002, 2004, 2006, and then in 2008, oddly, they appear like they didn't rise at all from 2006. And you know what you must recall is that this was the year that we started to have kind of our Great Recession here in the U.S. And then what you really see from that is 2010, 2012, they continue to fall. And housing wealth is where a lot of people in the U.S. Where they hold the majority of their wealth. So this really affects people. I think the other really interesting thing here is in this 25 percentile you see in 2010, 2012 it goes to 0. And that's because there are a lot of people whose houses are inside of this HRS data whose houses are underwater, meaning that their mortgage, what they owe on this house, is more than what their house is valued at currently, meaning they have a negative value for net value primary residence. That's really pulling down that 25th percentile. So, you know, we can really see here clearly the effect on housing wealth that the Great Recession caused here in the U.S. So everything that we've looked at so far, you don't have to be a registered user for. But the stuff that I'm going to talk about next, which is documentation and the harmonized data, we do ask you to be registered for. Registration is really simple. So if you visit our website, you would just click on register here in the top right. Again, as with everything on this website, it's a public good and it's free. We just request a little information about yourself, and then you can select to receive these emails, and these emails are just things like, hey, we're having another webinar, or there's new data that's available if you'd like to click that. So I'm going to log in right now with the user account that we've created. All right, so we have logged in. So let's talk about documentation. So I've shown you some ways to kind of compare what is available or not available between different surveys. But really the best way to do this is to use the documentation that's provided. So we've kind of developed two different kinds of documentation. And one are domain-specific comparison tables. We have that for several different domains. And one are domain-specific user guides. And these user guides are kind of working papers which really in-depth kind of go through how you can compare one particular domain, something like cognition. How is it asked in every single survey? How do people, what do people generally use to compare when it's asked differently? So let's go to our documentation page here. So for instance, let's say we're interested in cognition. So it might be helpful to know what cognitive measures are used across different surveys. We could click on this cognition here, and we get our summary table. So you can see the first thing that's here that's listed is verbal memory. So this is a test which includes usually an immediate word recall. So the interviewer says, here's 4 words, or a computer will read some number of words, and the person recalls them immediately, and then they're asked to recall them later in the survey, which is actually usually quite hard for people. But you'll notice that there's a difference in some of the studies. So in the HRS, in ELSA, in SHARE, in JSTAR, tilde, and Charles, they use 10 words. But CLOSA and Corellis in Costa Rica, they use 3 words for this list, and MHAS uses 8. So depending on what you're comparing or not, it's important to keep in mind these kind of differences, and this documentation is a great place to see what is asked in each survey. You can also see questions like verbal fluency isn't asked in every survey. So it is asked in MHAS, ELSA, SHARE, and tilde, but it's not asked in the HRS, CLOSA, JSTAR, Corellis, or Charles. So that's important to keep in mind. If we go back to our documentation page, you can also see here our working papers that you can download. And again, as I said, these are really in-depth papers which kind of go through every question inside of a survey that is asked and how it's comparable and how do researchers address those areas where it's not as comparable. And we're always adding to this list. So that's our documentation. And then as we finish up, let's talk about our harmonized data files. And it's by far kind of our most used feature of the Gateway to Global Aging data. So harmonized data sets are created to provide a harmonized measure or similar measures of international aging and retirement studies. Harmonized data sets define variables as similarly as possible to the RAND-HRS definition of a variable. So the RAND-HRS, if you're unfamiliar, is a version of the HRS data which is most highly used. So something like 90% of research which gets done using the HRS data use this version called the RAND-HRS, and it's because it's very clean, it's very user-friendly. So what we've done is we've tried to kind of create this very user-friendly, very clean versions of these data sets, and we call these harmonized data files. And we harmonize them to the RAND-HRS. Like the RAND-HRS, these data sets are structured in FAT format, where every individual is one record. Variable names are defined using the RAND-HRS format. For example, a variable called R1 work is whether the respondent is currently working in wave 1. And the variable names can also indicate how similar they are to each other. So for instance, a variable like R1 labor force underscore E is the respondent's labor force status in wave 1 of ELSA, but it's different than R1 LBRF in HRS. Give me just 1 minute. They also include spouse versions of most variables. And this is especially nice if you want to see kind of a family effect. So instead of doing spouse matching yourself, we've created variables like S2 work, which is whether the respondent spouse is currently working in wave 2. So for instance, if you were interested in households where both spouses worked, both spouses didn't work, or one spouse worked and one spouse didn't, it's very easy to identify those households without doing kind of the spouse matching yourself. So this is the currently where we are with the harmonized data files. So for the harmonized ELSA for England, we have the first 6 waves. It's all currently available waves of the ELSA data. Harmonized share incorporate the first, second, fourth, and fifth wave of share. Wave 3 of share was their life history survey, so it's not exactly comparable. Harmonized JSTAR is the first 3 waves of JSTAR for Japan. Harmonized CLOSA is the first 4 waves of the Korean data. Harmonized LASI currently is just that pilot data for India. The Harmonized CHARLES incorporates the first 2 waves of the Chinese study. The Harmonized IMHAS currently incorporates 3 waves of the Mexican study. The Harmonized CORELIS incorporates the 5 waves of CORELIS, or that Costa Rican study. And the Harmonized TILDA incorporates the first 2 waves of TILDA. Harmonized data files are distributed either through the website or by the originating study. And in some cases, the data are created by the users based on code provided by the gateway. So let's look at how you might know that. So if you click on Download Data and Links, the first thing you can see is we have a link to download the original survey data. So if you're interested in any of these studies and downloading their data, you would just click on any of these. So for instance, if you want to use the HRS, you would go to the University of Michigan to download that data. You can also download the harmonized data set. So for instance, for ELSA, they distribute the harmonized ELSA. And then in some cases, we say see Stata code below. And what that means is that we provide you a Stata code that you would run on your own, which would produce the harmonized share code in this share data set in this case once you run it, as long as you have the original share data. And then we've got code books, of course, lots of documentation for all the harmonized data sets. So let me briefly show you a little bit of the advantages of using a harmonized variable. So here's that skip pattern we saw earlier for share. So first question, have you ever smoked daily? And if you say yes to that question, you could ask, do you smoke at the present time? But a lot of researchers want to use a variable like, does the respondent smoke now? And you just want a yes or a no, a 0 or a 1. So we account for the small skip pattern here. So we have to use both variables. And then for you as a researcher, here you're able to just use one variable as opposed to 2. So, you know, we maybe cut something like 2 minutes of programming or syntaxing time out of you. And this is, of course, a really simple example. They're also much more complicated. So here's kind of the skip pattern for how JSTAR, the Japanese survey, asks about savings, how much you have in your savings account. They ask it in 2 different surveys which affect each other. So there's a lot of different ways that this can be derived. You also notice at the very bottom right there, are there unfolding brackets? And what we've done with the unfolding bracket values is we provided imputed values. So if the person says, I have a savings account, I'm not sure how much it is in it, but I know that it's more than 10 yen and it's less than 100 yen or something like this. We've assigned a value to that, and we've also created a flag variable for that. So this is something like, you know, for a very experienced economist or programmer, you know, this is maybe something like 2 weeks of work. Of course, this is value of savings is just one component of total household wealth. So if you wanted to go through all the different components which are asked inside of JSTAR to just get kind of a total household wealth value, this might be something like 8 to 12 months of programming. And say you're not an economist and you're interested in something completely different, but you think that wealth might affect it. And so you want to control for a family's wealth. We've then given you a variable and we tell you exactly how we do it so you can include that for your own research and really focus on those variables which you know the most about. As I mentioned, we have lots of documentation for all of our harmonized data sets. So each data set is accompanied by its own codebook. It includes a brief overview of statistics for each of the variables that are created. We include a lot of text that detail the variable creation and assumptions made in that creation. We highlight differences between waves for this harmonized variable and any differences between this variable and the RAIN HRS variable. And we list all the variables from the originating data set using the creation of this variable. So let's look at this. So this is from the Harmonized Share Codebook. All the codebooks are available to download in PDF from our website. Again, they're all freely available. So we make two variables really here for smoking. One is a smoke ever and one is a smokes now. You can see we have both a respondent level and a spouse level. So for instance, it's really easy in this case to identify a respondent who smokes and their spouse doesn't, right? Which might be interesting to look at. And then we've got variables for wave 1, wave 2, and wave 4 here for share. We've got an overview of some brief statistics. These are not population estimates because they're not weighted, but they are some brief statistics. We've assigned categorical variable codes. One of the things that you can see here is that if the value is missing, we use special missing values, which are part of SAS data and SPSS, to give you more information about how they're missing. So instead of coding something like don't know as a -1, we use a special missing value like .d. So if you're summing something, you're not going to get kind of these really odd values by not accounting for that. But that information is still provided for you. We include a lot of text here, just saying exactly how we created this variable, and in this case, it's relatively simple. We highlight any cross-wave differences in share, so if this question changed between different waves of share, we would do that. We would mention that here. And then we also mention differences with the RAIN HRS version of this variable. And the RAIN HRS is kind of our base point to compare different variables with each other. So for instance, here we say, in share, respondents are asked whether they've ever smoked daily for a period of at least 1 year. In the HRS, respondents are asked whether they've ever smoked daily regardless of whether the smoking was daily and not given a definitive period. So these are capturing something slightly different, right? So for instance, maybe someone smoked when they were 17 on spring break for 2 weeks or something, right? They would answer these questions differently. For share, you would say, no, I've never smoked. And for the HRS, you might say, yes, I have smoked. So these differences are really important, and they're important depending on what you're considering. So if you really just want to capture people who have, long time kind of smoking, the smoke ever variable from share might be really perfect, but you also might get kind of the sporadic smoking in the HRS question. So that's important to keep in mind. And the last thing we do is we list all the share variables used. And we do this because if you perhaps want to construct your own variable in a different manner, we really want to be transparent about how we constructed ours, and you can construct your own in whatever manner you want. This is a great starting point to come to see what are the variables that were used. I'll show you just briefly our more complicated example from the JSTAR, the Japanese survey that we saw that skip pattern for. And as you can see, we have a flag here, and this is an imputation flag. So this tells you things like how the value that you're looking at, how it was made. So whether it was a continuous value, meaning the person reported it. So they said, I have a savings account, and this is the blank number of yen that I have in it. A complete bracket, meaning that the person said, I have a savings account. I don't know how much is in it, but I'll tell you that it's more than some number of yen and less than some number of yen. So then we provided an imputed value that's within inside that range. But of course, not everyone provides both a top and a bottom bracket. So there's some where we just know that it's more than, say, 1,000 yen, and we still impute off of that. There are some cases where we don't know any bracket information, and we still impute. And then, of course, if someone says, I don't have a savings account, we know we can assign them a zero, but we let you know that here. And then you can also say, I don't know whether I have a savings account. And we see some cases of that here. And these are, of course, are imputed also, but in this sense, we're imputing both ownership, so whether they have a savings account, and then if we decided they do, then we assign them a value. So, of course, this level 7 here, there's a lot more assumptions. It's much less certain of an assignment, so that might be helpful to keep in mind. And then in the case of JSTAR top codes some values, so we flagged those also. Our how constructed text here is, of course, much longer. It's because it was a much more complicated procedure to create. And then here are our JSTAR variables which we used. So the last thing I'll briefly mention is our literature search. So we wanted to give users also kind of a central place on our website to compare studies and publications which were done just using this data. So we built a publications tab. So if you click on this, you can see here currently we've indexed over 5.5 thousand publications using this data. One of the nice things about this is that we've linked exactly which data set was used for each piece of research. So for instance, if you were interested in research that was just using the MHAS data, you could filter by survey and collect MHAS, and then you're going to get a bunch of surveys which are only using, which use specifically that MHAS data. You can also filter by topic. So for instance, if you're interested in using MHAS, you can also look at papers which look at MHAS and income together. You can of course search by title, author, source, or year. For any of the publications, we include a link, a direct link, if it's available on the internet, to that paper, or a link to Google Scholar. If you select multiple papers, we'll also you can export those citations in text, CSV, or EndNote file. So it's kind of just a central place that's a little more helpful than maybe using Google Scholar or PubMed, in the sense that you can directly know what are the topics which are covered quite easily, and what are the data sets that were used for that data. This is especially helpful if, say, you're interested in maybe cognition that was used, papers that looked at cognitive measures inside of SHARE. You can directly see what those papers are quite easily. These are updated. Our website, this database here, is updated maybe every 6 months, so there is a little bit of a lag in what gets updated here. So if you're interested in kind of the latest data, I would always say, check Google Scholar also, just for the latest data to make sure that it is there also. The last thing that I will mention is our help page. So we've got some frequently asked questions here, and then we've also got our help desk, which is here at the bottom. So we maintain an email help desk, which is help@g2aging.org. If at any time you have any questions about using our website, about using these data, about getting access to these data, if you're thinking about doing some research and you're wondering what's possible or what are some resources that might help you, please send us an email. We always try to get back to you all within 24 hours usually. We have a large team of people who work here at the Gateway to Global Aging Data. So we usually find the person who's best able to answer that question, and then we have them answer that and get that back to you. And it's always fantastic to hear what kind of interesting things people are doing with this research. So that will wrap up our webinar for today. This is an introductory webinar. I'll mention that we also have an advanced webinar coming up. So in today's webinar, I tried to give you an overview of all the different surveys which are available and some ways to kind of learn to navigate around those surveys to see what's there. We also have an advanced webinar coming up, which is really kind of a data tutorial for actually getting the data sets for these data and doing some cross-country analysis. And I talk about things like weighting and addressing different sampling frameworks for the different studies. So that's coming up this exact same time on October 20th. So if you'd like to sign up for that, hopefully that will be helpful for you. And if not, maybe we'll hear from you through the help. And I hope you've enjoyed today's webinar. I will now take any questions. So if you have any questions, you're welcome to, again, raise your hand, put them in chat, or pose them as a question. And I'll probably hang out here for about 15 minutes if anyone has questions.